Hi, my name is Megan Sevi. I'm a student nurse at Cedar Crest College. Today I'm going to be presenting on parent-provided distraction for children undergoing needle-related procedures. So first and foremost, if a child experiences a stressful situation in healthcare, they may have long-term consequences for the child in the future. So distraction is often a technique used to decrease the child's pain and distress levels. So the purpose and clinical question of this poster is that if parents are in the room providing distraction coaching for children, do the children report lower levels of pain and distress? Distraction has also been seen to buffer the experience for the child. So by this I mean that they may forget the negative aspects of the experience, making future experiences more pleasurable. It's also important to teach parents distraction techniques and see their supportive measures, since they often are in the room with the child during these procedures. And it's also a good idea to teach parents how to distract their children, because professional resources are sometimes limited. So to begin my study, I started by looking in 3 databases: CINAHL, Google Scholar, and ScienceDirect, and I used the key terms parents as distraction, parent presence, combined with the terms distraction, children, and hospitals. I limited my research to the years 2007 to 2015, and I looked for studies pertaining to how to parent-provided distraction during needle-related procedures. The first study that I found was conducted by McCarthy et al., which was a randomized clinical trial that had an experimental group, which was the parent-provided distraction, versus the control group, which was just routine care provided by the parents. They found that children reported significantly less pain and distress in the experimental group, so the parent-provided distraction. The second study I looked at was conducted by Carlson et al., and this was a descriptive design pertaining to how parents provide supportive measures during these needle-related procedures, and they found that parents said that they provided the best supportive measures by paying attention to how the child expresses him or herself. The third study I found was conducted by Sliffler et al., which was a randomized clinical trial as well, and it dealt with parent-administered procedures. So they did a experimental group, which was did parent-provided distraction, and they used a standardized toy, which was the LeapPad, versus routine care, and how parents usually provide supportive measures. And they found that there was really no significant change between the two, and it may be due to the fact that they we're looking at children that have already been previously diagnosed for a couple years now, and parents have been giving these parent-administered needle procedures, so that may be due to the fact why they didn't obtain the results that they were looking for. So some recommendations are that in the first study conducted by McCarthy et al., we can provide a longer distraction coaching intervention for the parents, since the distraction coaching intervention that they gave to the parents was only 15 minutes long. So if we were able to provide a longer intervention, we may see more significant results between the two groups. The second study conducted by Carlson et al., we can provide information. We as nurses can provide information to the parents prior to the procedure in order to decrease their distress levels as well, the parents' distress levels, because if parents' anxiety is high, the children's anxiety can be as high as well. So if we can explain to them why this procedure needs to be done, the parent may be able to provide more supportive measures for their child. And then the third study, a recommendation is that we as nurses get into the newly diagnosed patient homes, so the children's homes, and look at how they're behaving according to the parent-administered procedures, and get in there and provide distraction interventions for the children right away. So in conclusion, children who received distraction coaching did report significantly lower distress and pain levels, and even though in the one study there was little to no change, we saw that there was some change. So the best that we can do is get into the newly diagnosed children and try to intervene as soon as possible to get distress levels down before it's too late. So thank you for watching my presentation, and have a good day.